Hi, today's presentation is on the life-saving education, the role of advanced practice nurses in reducing maternal mortality and morbidity. So when we get started, I want you to close your eyes and imagine a world where death during childbirth or pregnancy no longer occurs. It's a dream and it's a noble vision, but is it realistic? It's not. So instead, I want you to think of a world where every pregnant person has a dedicated advocate ensuring safety and well-being throughout her pregnancy. So now, is this achievable? It is, and it's a mission that I'm passionate about and I'm committed to making a reality. My name is m.o.r.a.s.c.o. I'm a labor and delivery nurse. I'm an advanced practice nurse working both as a clinical nurse midwife and a clinical nurse leader. I'm a mother to 3 kids, and I am a healthcare professional who is not only passionate, but an advocate for maternal health and well-being. Many of you here today are nurses or in the medical field, you're educators, or you're just here and you're maybe pursuing your advanced practice degree or have already obtained your advanced practice nurse in obstetrical and women's health field. So you're here to join me in breaking through these barriers that we're facing and helping combat the reality, and that's the rapid rise of maternal mortality and morbidity. So today we're going to be talking about life-saving education and how advanced practice nurses can make a difference through that education through early detection of pregnant women. So I can remember her face. I can remember her name, the room, the day it was, the weather outside. And I can remember that moment in time when the room that she was in anticipation of having her baby was filled with joy and laughter, and in a second it changed. And it changed that second she looked at me and she said, something is wrong. And she was that type of patient that loved all that information, the good and the bad. So hours before, I spent a ton of time in there and educating her on her risks and her past medical history and things to look forward to. And I remember specifically telling her, you are going to know more than likely before I ever will, despite me monitoring you so extensively. You are going to know what you are feeling, what you're experiencing. And it was true. She knew much more than a monitor told me. She knew before that. And she knew so much more because of the life-saving education that was provided before life-saving measures needed to be executed with her. And that really stayed into my memory. After the hours of one of the scariest days I experienced, and one of the biggest obstetrical emergencies that I had to participate in, I remember driving home and thinking, what if? So what if she didn't tell me? What if I waited for her vital signs to change? What if she didn't know what to look for or what to feel? What if she didn't have that education that was provided to her before? What if? So understanding the why. Why are pregnant women dying? What is causing maternal mortality and morbidity? Sure, pre-existing conditions, and that would be blood clots, complications, abortion complications, obstructive labor complications, bleeding, high blood pressure, and infection. So we're facing this reality of maternal health. And according to the World Health Organization, 810 women die every single day from preventable causes related to pregnancy and childbirth. That's 1 woman every 2 minutes. So these are super scary statistics, right? And we can acknowledge them, but we need to dive deeper. So what is causing these tragic deaths? So we understand that they're dying from these conditions, but we really need to take that first step in preventing them, and that is how we are going to change these statistics. So really, this myth that is out there that maternal mortality is unpreventable, not true. The lack of education and preventative measures in maternal health care creates this gap that leads to higher rates of mortality and morbidity among pregnant women. So we need to address these gaps through targeted education, preventing these strategies and improve access to health care. And we can make significant strides towards reducing these preventable deaths and improving maternal outcomes. And we need to remember that it's not prevention. It's not just about prevention, and it's not just about reacting to the issues, but we need to actively work, right? We need to work through comprehensive education, and we need to work with preventative care, and we need to transform maternal health and ensure that every pregnancy ends with a healthy mother and a baby. So let's close our eyes again and imagine we're walking into an office or a clinic or any healthcare setting, really. And we're greeted by a professional who not only has an advanced clinical training, but also has the ability to provide comprehensive, personalized care. And that's an advanced practice nurse. So really, a nurse practitioner, a certified a nurse specialist, midwives, RNs with advanced education with specialized skills. Okay, so why is this important? Because advanced practice nurses play a vital role in our healthcare through their ability to deliver the care and management of conditions and specialized services, and their importance is further magnified when they work collaboratively with physicians and other healthcare professionals. So collaborative practice ensures a more holistic approach to patient care. And it really has each team member working together to have the best possible outcomes for our patient. And we're just not caregivers. We're leaders and we're advocates. Advanced practice nurses, like clinical leaders, like myself, will take on leadership roles in healthcare settings. So these are just important too, being away from the bedside, because they're the ones guiding teams, shaping policies that improve patient care and safety. So these efforts extend beyond individual patients, beyond the bedside, and really influence a broader health policy and practice standards. Advocating for patient rights, safety, and access to quality care, advanced practice nurses will enhance overall healthcare experience. Providing this comprehensive prenatal care and education to expectant mothers on healthy pregnancy practice, monitoring for early signs of complications is a proactive approach. It's going to allow for timely interventions that can prevent severe outcomes. Advanced practice nurses can support and empower mothers. They will help navigate the pregnancy, empower women, and instill this confidence that will ensure a mom and a healthy baby. And this quote really resonates with this whole thing. It's really about ensuring maternal health is not just about preventing maternal deaths, but it's empowering women to thrive. So let's continue. So now, imagine being an expectant mother, feeling a mix of excitement and anxiety, but unsure what to expect. Now, imagine having a knowledgeable, compassionate guide by your side, teaching you what to look for, how to keep yourself and your baby healthy throughout your pregnancy and after. And this is the role of the advanced practice nurse in educating pregnant mothers. Advanced practice nurses are going to educate pregnant mothers on recognizing early signs of complications such as preeclampsia, gestational diabetes, preterm labor. They're going to teach the mothers to monitor their blood pressure, recognize unusual swelling, understand the importance of tracking fetal movements. Education is vital because early detection of these signs can mean differences between treatable and manageable condition and a life-threatening emergency. Beyond recognizing complications, this advanced practice nurse is going to emphasize the importance of overall well-being of pregnancy, nutrition, physical activity, mental well-being, that will really ensure that the expectant mother will understand how the impact of their lifestyle choices on their pregnancy and their baby's health. Empowering mothers with knowledge and helping them take proactive steps towards a healthy pregnancy. Advanced practice nurses also follow established protocols and detect complication early, so includes regular checkups, monitoring vital signs, performing routine tests like glucose screening and ultrasounds. They will use these tools to really identify potential issues early and intervene before they become serious. And the goal is to really prevent the complications rather than just reacting to them. It's prevention over reaction. So think of it this way. Think of our advanced practice nurse as a lifeguard. An advanced practice nurse is watching and monitoring and ensuring the safety throughout the day. So we're looking at that lifeguard, and they are watching and they're looking and they're watching for those swimmers, right? They're not just going to show up after they get a call that someone's drowning, right? No, they're going to be watching that water, watching those swimmers, analyzing the weather conditions. They're going to watch for changes, safety. They're going to ensure that not only are the swimmers safe, but their environment is safe before an emergency or a drowning or them having to go out and save them occurs. This is the benefit of an advanced practice nurse. They are the lifeguards. They are providing pregnant mothers with education, knowledge, resources to ensure a safe and healthy environment for their pregnancy, helping prevent the complications before they arise. Call to action. So today we looked at the importance of the advanced practice nurse in maternal care while addressing the rising crisis of maternal mortality and morbidity. So we understand the statistics and the need for intervention and change. We understand how the role of the advanced practice nurse in healthcare and the collaborative practice influences maternal care. We discussed how advanced practice education with pregnant mothers help detect complication early, prevent serious outcomes for both mother and baby, and contribute to a healthier pregnancy. So now I'm looking at all of you as in the audience. Each of you have the power and ability to make a difference, where at the bedside with direct patient care or in a room or working in a boardroom on institutions, policies, and procedures. Either way, it is crucial. Participation is what will lead to improvement in care and outcomes of our mothers and babies. It will save lives. Be a voice of change. Advocate for maternal health and the importance that advanced practice nurses can have on the care that we provide our patients. Share what we have learned today. Together, we can come together and combat maternal mortality and the mortality and morbidity that is so rapidly rising. It's ensuring that every single mother receives the best quality of care and endless amount of resources. Advanced practice nurses are not just healthcare providers and nurses. They are educators, they are leaders, and they are advocates. Their impact on women's health is profound and far-reaching. By empowering mothers with knowledge and providing early interventions, advanced practice nurses are shaping our future in healthcare, and they are able to provide a healthier future for women and their families. As we conclude, let's leave together today with this powerful quote by Helen Keller. Alone we can do so little, but together we can do so much. The work of advanced practice nurses is essential to achieving this vision. So let's support and advocate and join together in the mission to help combat maternal mortality and morbidity. Thank you.